So today I'm going to be educating on, and you are going to be learning about heart diseases, and I will be focusing on heart attack versus sudden cardiac arrest. Okay? So sorry for that. I forgot that I lowered the music. So that is exactly what is going to happen. You are going to learn, I am going to share the information. But before we get started, I want you to do me a favor. Please share this link with your followers, your contacts, your friends and family. Please do that right now. And you know why you want to do that? Someone out there is experiencing the same signs, signals, symptoms of this heart disease that I'm going to talk about today. All the signs, symptoms that I'm going to mention today, someone out there is suffering, is experiencing such signs. So they don't even know what it is. So please share this link with someone you care about to save, even if it is a life. You're doing that today. Please go ahead and share the link, and thank you so much for doing that. Now, we want to talk about heart attack and sudden cardiac arrest. We want to see the difference. That's what we want to talk about now. Now, even though the title says heart attack versus sudden cardiac arrest, we are going to be unveiling many things about heart today. So if you are participating in our quiz, get your pen and paper ready, because I'm going to be giving you a lot of information that I'm going to be questioning you when we get to quiz session, okay? And it's going to be a bit different from what we did last week. So if you are interested, the interested people should send requests to me, and I'm going to bring you up to participate in this quiz. So I'm not just going to be saying it randomly and everybody would be answering it. If you are interested, just send me a quiz after after I finish my speech, then you can just, get in. So, and I also want to encourage you to get your account number ready in case you win. Of course, I pray you win, okay? So you can quickly give us your account number, okay? So let's get started. Now, in my flyer that I share on my WhatsApp broadcast, it says, can someone with no high blood pressure have heart attack or cardiac arrest? That was the question on my caption. I attached that information with the caption. Can that happen? Because many of us don't even believe that someone without high blood pressure can have heart attack. And that's what I'm going to unveil today. And the answer is yes. Absolutely yes. Someone can have heart attack or cardiac arrest even if they do not have high blood pressure, called hypertension. Now, why high blood pressure is a significant risk factor? It is just one of many factors that can lead to this event. Now, here is a breakdown of why this is the case. Let's start with heart attack. And the medical term for heart attack, and you're going to learn a lot of medical terms today, okay? So, heart attack, we call it myocardial infarction. Myo with M-Y, myocardial infarction. A heart attack occurs when the flow of blood to the heart muscle is severely reduced or blocked. Now, this is the area I'm going to be telling you the difference between heart attack and cardiac arrest. Pay attention. Heart attack happens when the blood that flows in your body to the heart muscle is severely reduced or blocked, usually by a blood clot. This is most often caused by coronary artery disease called CAD. You can say CAD or CAD, which is the buildup of plaque, that is fat deposits and cholesterol in the coronary arteries. Remember, if you receive one of my video that I talk about atherosclerosis, I mentioned about build-up plaque. That's what I'm talking about. Now, there are a lot of other factors besides high blood pressure that increase the risk of plaque build and heart attack, and these include high cholesterol. Remember, I mentioned it in my video that I shared talking about atherosclerosis. High levels of LDL, that is the bad cholesterol, directly contribute to plaque formation in the arteries. Arteries is like holes in your body where the blood passes through to every part of your body, including your heart. So if you had bad cholesterol alone, you don't have high blood pressure, you don't have diabetes, you don't have anything, but you have high cholesterol, LDL, you can have heart attack. Smoking or tobacco use can also damage blood vessels and speed up plaque build. Diabetes can also cause it. Yes. High blood sugar levels damage the arteries over time. Yeah, if you don't know, I'm telling you today. If you have high blood pressure, and diabetes, high blood sugar, you can have heart attack. Obesity and lack of physical activity. You don't have a diabetes, you don't have high blood pressure, you don't have high cholesterol, but you are obese and you lack activities. You are not moving your body, you are not going anywhere, you are sitting all days, you are sleeping all days. That is lack of physical activities. These contribute to poor overall cardiovascular health. You need to move that body. You need to exercise. You need to lose that weight. Family history is a very strong factor, because a strong family history of heart disease can increase risk regardless of your lifestyle. It can. Whatever lifestyle you have, you better have a healthy lifestyle, because there is something you can do to erase that history. Yes. You erase the history. Something that someone that have become a victim or that have become, part of this, of heart attack, in your family cannot do or have not done. When I say have not done, it means that person actually died of that heart attack. And the family, they see it as family problem, family disease. No, there's nothing like family history. You can erase that history. And what you will do, one thing you will do to erase that, I'll tell you in a minute. When I get there, I will remind you. Stress can also contribute to heart attack. Chronic stress can negatively affect the heart and shut it down. And lastly, a spontaneous tear in an artery wall, the hole, the blood pass through, that is what we call artery. So the wall, just the side, is what we mean by wall. So that tear in artery wall, we call it severe spasm of a coronary artery, scarred. It can cause heart attack. Now, what about cardiac arrest? Many people call it sudden cardiac arrest. Well, it is sudden to you. To me, it is not sudden. And I will tell you why it is not sudden. First of all, I want you to have an understanding that cardiac arrest is different from a heart attack. Based on the definition I just gave you as heart attack now, cardiac arrest is an electrical problem where the heart suddenly stops breathing effectively, often due to an irregular heart rhythm. We call it arrhythmia. Now, you can see the difference of both. Cardiac arrest is an electrical problem. That means that when that electrical signals that make your heart beat, there are some electrical signals. When your heart is beating, contracting, boom, 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 it's called electrical signals. You are getting electrical signal, something electrical making your heart beat like that. If that electrical, machine, I will label it machine, it becomes damaged. Which is, we call it malfunction. So if it become malfunction of the heart, that is when the cardiac arrest happened. So cardiac arrest is an electrical problem where your heart suddenly stops beating effectively due to an irregular rhythm, which is a malfunction of the heart's electrical system. It means that your electrical system in your heart become malfunction. It's not working. It's no longer doing the work. Normal, regular beating. It's no longer doing it. Now, why a heart attack can trigger cardiac arrest? Cardiac arrest can also happen on its own due to underlying conditions that may not be linked to blood pressure. Yes. Whether you like it or not, it can happen. You don't have to have high blood pressure before all this happened. Because we used to say, okay, I have high blood pressure. If you have high blood pressure, you will have heart attack. No, not at all. You don't have to have high blood pressure before you have heart attack or cardiac arrest. Again, we have underlying conditions that is not even blood pressure, high blood pressure, that can cause sudden cardiac arrest. Underlying heart conditions that cause a thickened heart muscle. We call it cardiomyopathy. Cardiomyopathy. Myo, M-Y-O, is muscle. Myo is a medical term of muscle. Add it to cardio, which is your heart. So myo plus cardio is myocardium. So it becomes the heart muscle. When the heart becomes thick, the heart becomes abnormal. That abnormality is the disease which is called pathy. So cardiomyopathy is what we are talking about. That is one underlying condition that can cause sudden cardiac arrest. Another underlying condition, heart condition, is scarring from a previous, possibly unrecognized heart attack. What that means is, if you have heart attack before, and that caused your muscle to tear and you did not know, basically, that is what make it unrecognized condition anyway, because you don't know. That can cause cardiac arrest. Next is electrical abnormality, arrhythmias. You can call it cardiac arrhythmias or dysrhythmias. What are arrhythmias? Arrhythmias are a group of conditions where the heart beats in an abnormal rate or rhythm. When your heart is supposed to be beating normally from 60 to 100, and it begins to beat slowly or it beats fast, that is arrhythmias. It means your heart is no longer beating the way it's supposed to beat. Essentially, they are caused by problems with the electrical signal that coordinate the heart contractions. A heart that beats too quickly or too slowly or become irregular, that irregularity cannot pump your blood efficiently, which can impact the lungs, brain, and other organs. So if that electrical signals, when your heart is contracting, pim, 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 and it stop contracting slowly or begin to contract, pum, 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 it's fast, that is arrhythmias. Either slow or fast, or it beats irregularly. So they are caused by problems with the electrical signals that coordinate that particular heart contraction. If your heart beats between 60 to 100, you go to your doctor and they do your EKG and they realize that you beat between 60 to 100. That means your heart beats normally. Your heartbeat is normal. When your heart begins to beat slowly or start beating very fast, that tells us that something is wrong with those electrical signals. That is what we call arrhythmias in a medical term. The electrical signals has become abnormal. That is electrical abnormality, the arrhythmias. To understand arrhythmias, I think it will help to know how a normal beat works. And for that to happen, a tiny cluster of a special cells called sinus node, that is the heart's natural pacemaker, it generates an electrical impulse. I'm sure you've heard someone or anyone or anywhere saying that they had heart problem and they insert pacemaker in the heart. Your heart has a natural pacemaker called sinus node. When that one is faulty, that is when they replace it with artificial called pacemaker. Okay, so that tiny cluster of a special cell called that pacemaker generates an electrical impulse. Now, when heart's natural pacemaker generates an electrical impulse, this impulse travels across the upper chamber of your heart called atria, causing them to contract and pump blood into the lower chamber called ventricles. The signal is then delayed, maybe briefly, at the atrioventricular node, that is the pacemaker, to allow the lower chambers called ventricles to fill with blood. So when that happens, AV node That is the secondary pacemaker. That is located at the lower chamber of your heart. Your heart consists of 4 chambers. It has 2 upper chambers and lower chambers, making 4 chambers. The upper chambers are called right atrial, left atrial, while your lower chambers are called right ventricle, left ventricle. After the impulse travels around the upper chamber of your heart called atrial, causing them to contract and pump blood into the lower chamber of your heart, the signal is then delayed briefly at the pacemaker. Okay? I mean the secondary pacemaker called atrioventricular, to allow the lower chambers called ventricles to fill with blood. Now, after the lower chambers is now filled with blood, the signal travels through the ventricles, the lower chamber, causing them to contract powerfully and pump blood out of the rest of the body. So the blood comes from the upper chamber to the lower chamber, and the lower chamber ventricles push the blood out to the parts of your body. This is how your body, your heart pump and dispatch blood to every part of your body. If your heart functions exactly like this regularly, you have a normal heartbeat. Your heart resting heart, your resting heart rate should beat between 60 to 100 beats per minute. Shouldn't be lower, it cannot be higher, because that's the normal heart rate beat per minute. But if your heart beats too fast or too slow, it means your heart rate is irregular. An irregular heartbeat cannot pump blood efficiently, which can impact the lungs, brain, and other organs, because these organs are connected. Every organs in our body, they are connected. When your heart beats too fast, over 100 beats per minute at rest, you will be diagnosed of tachycardia. So if you go to the hospital and they put tachycardia in your report, it means your heart is beating too fast. And when your heart beats very slow, that is called bradycardia. Bradycardia. That is under 60, below 60. You have abnormal heartbeat pattern. If your heartbeat is irregular or displays extra beat, if your heart often feeling like skipped or fluttering, it shows you have abnormal beat. Now, heart attack occurs because there is an underlying condition that causes a heart attack, which develops slowly over decades. It develops long time ago. That is what caused indeed sudden and catastrophic critical event. So it's not something that just happened. It has been there in your body for a very long time. It could be 1, 2, 3, 4 years. Let me use this analysis to make you understand. If you have, let's take factory that has machine, that has a belt. Maybe you are producing plastic bag and that belt needs to roll. Now, when the belt is rolling, you are producing massively. Everything is perfect. Everything is good. You are making sales. Now, when the belt begins to weak, that belt, you will be seeing the sign in the machine. Either it is slow or it works fast. to tell you that something is wrong with that factory machine. But because we don't pay attention, or we want to say, oh, let me manage it. Maybe by tomorrow or next week, I'll get another one. We keep using it, managing it. All of a sudden, that machine, maybe during the production, it just cuts into two. That problem did not start that day the belt cut off, damaged. It has started maybe a month or a week or 3 months or a year before that time. So there is nothing sudden. We see signal for a very long time. Our body has been telling us something, but we ignore it. You sit next to someone and the person is beating very fast. Or if anybody sits next to you, it could be your spouse, your child, your parents, your friends, whoever that person is. If you can hear the sound of the breathing of that person, it means there is a problem. That person is having breathing problem, heart problem. These are the signs you should be taking a look at. You should do something before it is too late. So there is nothing sudden. And this sudden nature of a heart attack comes down to an acute blockage in the blood supply, which is typically caused by a rapid change in coronary arteries, called coronary artery disease, CARD, which involves a slow, gradual disease process called atherosclerosis. I mentioned that in my video that I shared with you. The plaque build an artery narrowing. When the artery that supply blood to your heart becomes narrowed, thin, it's supposed to wide so that the blood can pass through. But when it becomes thin, the blood will not be able to pass through it. And what causes this plaque to build up in your artery? Cholesterol, fatty food, all this junk, all this fat food we eat. If you see some people will be eating vegetable egusi, melon soup, or just vegetable. Vegetable, yes, or regular stew. When you look at this soup, you will see oil, either vegetable oil or red oil. You will see it like before you get to the stew in the bottom. You will be putting your hands to like about 3 to 4 inches before you get there. And they will mix it together. Some will even mix it together. When they finish eating the swallow, they will mix that stew together and they will drink. These are what we call fats and cholesterol. When they are too much in your body, they store, become thick, and block your arteries. Yes. When the plaque is built in your arteries wall, it slowly narrows the arteries opening, reducing blood flow. This chronic condition is not sudden at all. I'm proving it to you now. Nothing is sudden. The sudden event is when the plaque rupture, breaks open, and form clots. The heart attack becomes a sudden event when one of these plaques becomes unstable and ruptures. Now, for this sudden event to happen, a sudden rupture must have triggered a rapid chain of events. And the first thing that happens when these ruptures happen is when the fibrous cap protecting the fatty core of the plaque tears. When it tears open, breaks open, which we call plaque rupture. That is the first event that happens. For you to know the gradual process it takes for that heart attack to happen. That's what I'm breaking down for you. There is an immediate response that makes the body recognizes the rupture as an injury to the artery wall. That is the second thing that happens. Your body will receive the signal. Immediately that ruptures happen. Okay? Immediately the body recognized the rupture in the artery wall. Clotting cascade happens. What is that? That triggers an immediate aggressive clotting response. We call it platelets. The tiny colorless, cell fragments. Fragments in your blood. The cell that stops bleeding by thickening together to form a plaque. You can also call it thrombocyte. You can call it thrombocyte. This thrombocyte, when this immediate response, the body recognizes it, the thrombocyte rush to the site and rapidly form a blood clot over the ruptured plaque. Now, don't get me wrong. Thrombocytes are good cells because they act as the body's natural bandages, stopping blood loss and helping wounds heal. They are vital for surviving surgeries, injuries, and fighting diseases. Thrombocytes, they are good cells. When you have any wounds and it heal quickly, your thrombocyte made it happen. If you have surgery, like they cut you open, thrombocyte make it heal up quickly. When you get sick and you heal quickly, thrombocyte make it happen. Okay? Now, sudden blockage. When it comes to, in the case of that heart attack, when clotting cascade happens, sudden blockage occurs, which is caused by this thrombocyte. So the same way it can make you amazing, same way it can cause problem. And when sudden blockage, the newly formed, blood clot, the thrombocyte, quickly grow large enough to completely block the artery within a minute. When sudden blockage happens, these thrombocytes, they grow large, they become large and block the artery within a minute. And when the blood flow is suddenly and severely cut off, because of course when something block it, that means no blood is flowing there. It means it's cut off, right? The part of the heart muscle supplied by that artery is deprived of oxygen, called ischemia. When you have a hole where the water runs through, and all of a sudden the water is not going through, this is a perfect example. So without oxygen, heart muscle cell begins to die, which we call infarction, within a minute. This is a process that is sudden and life-threatening. You can see what it takes for this suddenness of your heart breakdown takes before it happens. It's a process. And this thing it doesn't happen within, immediately. All this process did not happen immediately. When the blockage happened, of course, if you are expecting water on a flower, and for instance, when we expected rain to what we plant, and it's not coming up, the water will die if you don't wet the flower. The flower, the plant will die if you don't give it water naturally. Artificially, watering the flower. They receive natural water from the rain. So immediately they don't receive it, they will die. Exactly that's what happened. I'm just using all this as an example of how you can understand how heart attack or cardiac arrest happens. Now, when it comes to heart attack, I want you to pay attention to how the person, what will happen to the person that has heart attack and the person that has cardiac arrest. Though the person will still be awake, the person that has heart attack will still be awake and conscious, not unconscious. They will still be awake. Their heart usually continues to beat. But because of the blocked arteries, the arteries that blocked, damaged, the heart may beat weakly. It means that your heart will not be able to be beating normally. And when your heart is not beating normally, what does that mean? You need help. You are not dead, but you are not enjoying your life. Because if you cannot breathe, what exactly can you do than to look for help? No, so now, the person with heart attack can still breathe, is still conscious. It's just that you will not be able to breathe. Your heart will not beat as it used to, as a normal breathing. You won't have a normal rhythm. Now, in summary of this heart attack, even though a heart attack happens suddenly because it is caused by a sudden acute blockage, a blood clot forming over a ruptured plaque, which immediately starves the heart muscle of oxygen. Yes, it develops slowly over decades. It starts long time ago. Heart attack occurs due to an underlying conditions. This is the reason why I said heart attack is not sudden. Because something has been happening inside of you to your heart, which you don't pay attention. If you are breathing normally and all of a sudden your breathing become loud, people can hear you breathing, or you sleep, you are snoring, your snoring is so annoying, and this has not been happening to you before, check yourself out. Something is wrong. Don't waste time. And for those of you who often use the terms interchangeably, that a heart attack and sudden cardiac arrest are two, are the same. They are not the same. They are two different conditions. Though they are related emergencies. They are not the same. They are not the same conditions. They are different. Now, the simplest way to think about difference is using this analogy. Heart attack is a plumbing problem, circulation problem. When the blood flows in your body, your heart is blocked. That is when you have heart attack. So it's a plumbing problem. Why sudden cardiac arrest is an electrical problem. It's about rhythm, how your heart beats. When the electrical signals that coordinate the contraction that pump your blood is having problem, remember I call it arrhythmias, that is sudden cardiac arrest. I'm not even going to put sudden there. I'm just going to say cardiac arrest because there's nothing sudden. A heart attack is a circulation problem caused by a blockage. We call it myocardial infarction. And it happens when a blood clot suddenly cuts off blood flow to a section of the heart muscle. Then the heart muscle is starved of oxygen and begins to die, called infarction. What happens to the person that has heart attack, the person is usually awake and conscious. The heart usually continue to beat because the blocked artery is no longer working. Now, here are the symptoms. You begin to have chest pain or chest pressure. You begin to have discomfort in the arms, jaw, on your back. You begin to have shortness of breath or nausea. You begin to sweat. These symptoms can be sudden and intense, or they can start slowly and persist for hours. You know what you're going to do? Straight to the emergency. If you have all these signs, especially shortness of breath and chest pain, they don't take it for granted. If you get to emergency and you have thousands of people waiting to see the doctors, and you get there and you complain of chest pain and shortness of breath, they put you in first. You know why? Because it has to do with life. Anything can happen. I know how day to day in the hospital, runs in the hospital, because I work in the hospital. Almost all the departments, urology, oncology, surgery, emergency, cardiology, I know how it works. You go to emergency, straight away, they put you in first. Because if anything happens to you without them acting on your complaints, your symptoms, they are in trouble. That facility is in trouble. Yes. So if you have all these signs, chest pain, discomfort in your jaw, back, arms, shortness of breath, you can still, if you don't have shortness of breath or chest pain, and you have every other signs, it could be related to another symptoms, another problem. If you have nausea, maybe you are pregnant. If you are sweating, maybe you are in your menopause. That's one of the menopause signs. They can say, oh, she's pregnant, or that's okay. But when it comes to chest pain or shortness of breath, that is heart problem. You go to the emergency immediately, not to your doctor, to emergency. Like I said, sudden cardiac arrest is an electrical problem caused by a malfunction. Malfunction. That is the word you need to put in your head. Electrical problem caused by a malfunction. And the problem is electrical. It is not physical electrical. Your body has electrics in there, especially your heart. It happens when the heart's electrical system suddenly malfunctions, usually due to lethal arrhythmia, like ventricular fibrillation. Okay? The heart ventricle begin to quiver uselessly instead of beating, causing your heart to stop pumping blood effectively. Because if that electric is not working, the electrical, system is not working, that means it will not pump your heart. And if your heart is not pumping, it means the blood will not flow. And if the blood is not flowing, that is heart attack. Yes. Now, what happens to the person with heart attack? With sudden cardiac arrest? The person suddenly collapses without warning. They are unresponsive and unconscious. They have no pulse. They will not breathe. They can be gasping. That's what they will do. If not treated within minutes, the person will die. That's it. Or have permanent brain damage. If the person did not die, he will have a permanent brain damage. As you can see, there's difference between the two. So they are different. Now, what is the treatment? Treatment is simple. Cardiac arrest requires immediate CPR. Your sudden cardiac arrest, it requires immediate CPR. That CPR, they do it to resuscitate your heart. So it requires immediate CPR and a defibrillator to deliver an electrical shock and restart the heart's normal rhythm. And that's why I feel so sorry for a country that has no first responder. A country that you cannot even pick your phone and call the hospital 911 or call this emergency department, and they get there right away to perform CPR, to resuscitate people, either during the accident, because a lot of things happen when accidents happen. Many people, if they are, like I said, high blood pressure can cause it. Some accident, nothing will happen to the car. But for the fact that that person is in the car and he see that things happen, he can be shocked and go unconscious for minutes, for minutes, hours. If this first responder didn't get there, or nobody around there that can even perform CPR to resuscitate the person, that country is a problem. There's a problem in that country. Where on this earth you will see a country that you cannot even call somebody, emergency department, provided by the government, to send responders, those who can perform CPR to resuscitate people. Where on earth? And this is the reason we lose a lot of souls. Government should see into this. Our police department, police officers, they need to be trained for CPR. Because here, when they call 911, the medical team and police department, they always come together. That's what happened. They always come together. One second. They always come together. Those police officers, military, they will teach them CPR, how to perform CPR, to save lives, because anything can happen. And in this CPR, when you were trained as a CPR specialist, you are automatically become what I call someone who can treat anyone in that condition. Good Samaritan. That's the name that I'm trying to remember. This Good Samaritan is incorporated into your certificate as a CPR. What that means is you can treat anybody. You don't have to be in your location or in your state or in your country. You can treat anybody that has this heart attack or cardiac arrest. You can perform CPR. So that is why CPR is important. As you can see, cardiac arrest and heart attack signs are pretty the same. This is to tell you that they are related and emergencies case. They are emergency cases. An heart attack can lead to sudden cardiac arrest because the damage to the heart muscle can disrupt the heart's electrical system, causing a dangerous arrhythmia. Now let's quickly review the food for the heart health. And these will focus on diet, digestion, and emotional balance. This means the dietary suggestions align closely with modern cardiologist recommendations for whole and processed foods, but with a focus on a specific warning. Spices and herbs to support circulation and vitality. So now, here are the keys. The key foods, herbs, and spices suggested for heart health. Now, we advise consuming freshly prepared, easy to digest, seasonal foods and minimizing processed items, excess salt, and refined sugars. Remember, cardiovascular problems start with high blood pressure, which cause what happened to my oh no, how did I get off my TikTok? Jesus, am I still on TikTok? Something is wrong. Jesus, what happened? Okay, say resume. Why is it taking me out of TikTok? Oh Lord, I hope people are still on. Can you guys hear me from TikTok? Because I don't know why TikTok just stopped. Anyway, let's move on since we have our YouTube channel. So what am I talking? What am I saying? Let me quickly share this because you guys need to hear this. I don't know why the TikTok just gets me off, disconnected me from TikTok. I don't know why. So sorry about that. This social media is just something. Please give me one moment. Okay. Okay. I'm trying to share back the link. I don't know why TikTok just gets me, disconnected me. Oh. All right. So, can you all hear me? I don't know why TikTok just disconnected me. I have no idea of that. Please help me share this. Please share it so that people can come back. Okay. Let me see. All right. So let's continue. So, I was talking about the food that can help your heart. And I said, remember that cardiovascular problems start with high blood pressure, which can cause by high sodium intake, that is salt. So you need to avoid salty food, refined sugary foods, and processed food, and go for easy to digest food, which are fiber foods, fresh food, and whole fruit. That is basically what you need to do. Now, for you to know what type of food that are good for all this I just mentioned, food like oat, barley, quinoa, brown rice, and millets. They are good legumes food for your heart. You want to go for split yellow grain lentils, These are very highly recommended. Lentils like beans and chickpeas, they are good. Blueberry, strawberry, pomegranate, that is also good. Apples are good. Grapes are excellent. Leafy greens like spinach, kale, they are good. Beet, like a beetroot, beet, the leaf, or the root, the water, the juice is good. Carrots and gourds. Gourds like bitter gourds, bottle gourds, they are good. When it comes to healthy fat, because that is where the problem is, this is the recommendations for that. Ghee, that is a classified butter. It's in the store. It's called ghee, G-H-I, ghee. That should be in moderation. But olive oil, flaxseed, and walnut, they are excellent. Now, there are herbs called cardiotonic, heart strengthener. These herbs, you want to experiment on them, especially if you have heart problem. If your breathing is not good, you want to quickly run to the market, to the supermarket, to the store, and get these cardiotonic herbs. Arjuna, Arjuna is known as the hero of the heart. Its bark, the bark, is traditionally used to strengthen the heart muscle, improve circulation, and help manage blood pressure and cholesterol. Ashwagandha, beautiful, that is also good. It's an adaptogen used to reduce stress and cortisol levels. Now, since chronic stress significantly impacts your heart health, when you begin to drink this ashwagandha, or you can have it as a supplement, it begins to support your cardiac resilience by calming the nervous system down. So ashwagandha is good. You can go for ashwagandha. It's good. It's perfect. It's good for stress. If you're going through stress, take it every day. And it's also good for your heart. Now, when it comes to circulation and anti-inflammatory spices, you want to do garlic, you want to do ginger, you want to do cinnamon and turmeric. These three spices, they are excellent. You shouldn't even think of not having them in your house. You need to have all these three herbs, these spices in your house. If I enter in your house, you don't have the garlic, you don't have ginger, you don't have cinnamon. Cinnamon, you can be adding it to your coffee. If you're a coffee type, you can add it to your tea. Add it to your cooking. Depends on the type of the cooking. Turmeric is good. You can add it to your stew. Garlic, ginger, blend it with your pepper and make stew. Apart from doing wonderfully in your heart, in your body, it preserves your food. Garlic, ginger, they preserve, and turmeric, they preserve food. They are like a preservatives. Your food will not get contaminated on time. If it has to spoil for 5 days, it will extend the lifespan. That is why I use it in my own, all the food that I make, I have them in there. They are all anti-inflammatory spices. And finally, a heart-healthy lifestyle is a holistic approach combining several daily habits to reduce your risk of heart disease, stroke, and high blood pressure. You want to get regular physical activities. I want you to pay attention to all these activities, because this is your perfect things you can do, especially if you have history of this. You have a family history of heart attack or cardiac arrest. You want to get regular physical activities. Exercise strengthens your heart. Exercise, it strengthens your heart. It helps you manage weight and keeps your blood vessel flexible. When you exercise daily, now practice this. If you have not been exercising, if you're not been exercising your body, just start it one day. You can choose to be dancing. Dance is also one of the exercises. Okay? You can choose to be dancing. You can choose to be walking every morning. You can choose to be running every morning. You can choose to be doing gardening work. Clean your environment. You can decide to go to the gym. When you try it one day, tell me how you feel. If you have been having pain in the leg or any part of your body, it will stop immediately. Even though when you go to the gym, there are some machine that you will be on. After you use them, you feel it in your body. You will not feel it immediately. Maybe the next day you will be feeling it. Now, I went to gym about 2 days ago. There's a new equipment that I just got on. The next day, I was feeling pain in my thigh because I have to push this back and forth. I feel it. I know it is new to my body. That will happen. That is not the reason why you should not do exercise. No. It's just a sign that your body is now getting something different you have not done before. And as time goes on, it just go away on its own without doing anything. And if the pain persists, just take ibuprofen, pain relief, that's it. So you want to engage in muscle strengthening activities like body weight, resistance bands on 2 or more days per week. Start like that. If you have not been practicing, if you have not been exercising, don't start it one time. Like I said, you want to adopt this healthy lifestyle. It is not something you can just start immediately. It takes a gradual process. Because you are trying to crowd out of unhealthy lifestyle. You can't just jump into healthy lifestyle. You do it maybe twice a week. Later, you increase your days to 3, 4, 5 until you can be doing it every day if you wish to. But if you are a pro, everything, you're good to go. You also want to sit less. This is where the problem is with many of us. We sit too long. I said it in my last live show. As a boss in the office, don't use that your superiority to hurt yourself. If you are in the office, whatever you want to take, get up. Even if it is a mile away from you, get up and do it. Go and get that file yourself. You are strengthening your body. You are exercising. Don't say because you are a boss, you are paying for somebody, let him or her do her job or his job. No. It's right there. Get your butt up and take it. Get it. Grab it. And if you are a lady, you are in the house, full housewife, whatever you are, get up and get that remote. Stop calling the house guy in the 3rd floor to come down and get that remote for you. For what? You need to sit less. Break up long period of sitting by standing, walking around and stretching every hour. Yes, any movement is better than none. You can't just be stagnant. Sedentary lifestyle is no to any human's body. You need to move that body. You also need to quit smoking. Smoking severely damages your heart and blood vessel. Your risk of heart disease starts to drop almost immediately after quitting. So that is why you want to stop. You also want to avoid second-hand smoking. Anywhere they are smoking, run away. I hate smell and smoke. When I was in New York, when I get into a train and I smell something or smoke, I am going to get out of that cart, go to another cart, because this cart is about 7 to 6. I can go on, jump on anything, anyone. So I run away from secondhand smoke. Stay away from environment where you might breathe in smoke. Even if you are not smoking, you are indirectly, not even indirectly, directly smoking, because you inhale those smokes. You want to maintain a healthy weight, because carrying excess weight, especially around the middle, puts extra stress on your heart and increases your risk of high blood pressure and diabetes. So lose it. If you have one, lose that fat. And there's many ways you can lose it. There are many ways. You can do it by walking, doing physical activities, eating food that can make you shrink that fat. Lose it. Next, you want to manage stress and sleep by practicing relaxation techniques like deep breathing, meditation, or yoga. Just find a healthy hobby you enjoy to disconnect from stress. Any healthy habit that can disconnect you from all this stress, find it. You also want to have a quality sleep. Many of us don't sleep. Personally, I'm guilty of it once a while. But I know how to make it up. Because if I don't, I will receive the signals. I'll begin to have headache. I'm just going, I shut down everything. I'll sleep. Aim for 7 to 9 hours of good quality sleep per night. Night, not daytime. So I feel sorry for those who work night. Because when you sleep at night, some processes take place. Something happens at night that can only happen to your body at night, not during the day. So if you are not having that 7 to 9 hours for that thing to happen, then you are missing. I'm going to come back and tell you what happened when you sleep, from that time you sleep to the next day. Things that happen to your body. I will come back and tell you. If you have symptoms of a sleep disorder, please, like chronic snoring or constantly waking up tired, talk to your doctor, or talk to a doctor if you don't have one. That's a sign that something is wrong with your heart, especially when you are snoring. If you have been snoring from birth, that possible? I'm not sure. If suddenly you realize that your breathing just changed, that's the problem there. You know something is wrong with your electrical heart breathing. That is arrhythmia. Okay? Or you wake up tired all the time. Talk to your doctor. And lastly, know your health numbers. This is common. You want to know your health numbers. It's very, very important. This is important. You want to check your blood pressure regularly. High blood pressure usually has no symptoms. Some don't have symptoms. They tell you some people don't have symptoms. Know your LDL, the bad cholesterol, and the good cholesterol levels. Know it. Monitor and manage your blood glucose, especially if you have or you are at risk for diabetes. You want to keep your weight in a healthy range. Monitor it. Okay? Ensure this lifestyle factors are on track. If you can do all these that I mentioned, trust me, you are good to go. Now you can see that all that I've mentioned so far to keep healthy lives of your heart They has to do with managing cholesterol, high blood pressure, and this diabetes. They all talked about your lungs, your heart, your kidney, your liver, everything inside of you. They talked about it. Now, with all this I mentioned, about 10 things that I asked you to do, that is a perfect things you can do to maintain healthy lifestyle. And if you can do it, your optimal health is guaranteed.